Good day. My name is Prince Xieder Tinguha and I'm here to discuss my capstone project titled Acknowledging Nursing Shortage to Provide Safe and Quality Nursing Care. Nurses are a vital component of healthcare and make up the largest unit of health professional according to WHO in 2020. To provide quality healthcare, sufficient number of nurses is needed. With the present healthcare environment, one of the major issues that health systems face globally is a nursing shortage. According to Statistics Canada in 2021, registered nurses and registered psychiatric nurses experienced the greatest rise in job opening among all professions during the preceding 2 years and shows an increasing demand of nurses due to increasing health services demands and shortage of nursing staff. Shortage of nursing staff has a negative impact to the nurse as well as the patient care outcome. In a study by both Muabowe in 2018, nursing shortage is caused by rising demands for health services, a decreasing workforce, nurses retiring and quitting entirely due to unpleasant work circumstances. In addition, violence in healthcare system, lack of seats in nursing programs, nursing faculties shortage, insufficient number of nursing students completing their education also contributes to the shortage of nurses. According to Lavoie-Tremblay et al. In 2019, short staffing has a negative influence on nurses' well-being, leading to burnout, increased stress, workplace violence, intention to quit, absenteeism, and job discontent. Nurse shortage also compromises patient care. According to Perkins in 2021, inadequate nurse staffing has been linked to an increase in unnecessary fatalities, readmission rates, hospital-acquired infections, and poor quality of care. As a future nurse leader, it is important that appropriate nurse staffing and workload be achieved. To achieve proper nurse staffing and answer nurse shortage, action must be taken including nurse retention and recruitment. First is to promote nursing as a profession choice to secondary students and increase enrollment and corresponding fund by 10% annually for 5 years. According to Ridge and Corno in 2020, presenting nursing careers and training opportunities to secondary education students enhances their understanding of nursing as a career choice. Offering scholarship and grants can assist to make nursing profession more accessible and affordable, making it a realistic alternative. Another strategy to achieve adequate nurse staffing is maximizing licensure reciprocity and expediting the process for internationally educated nurses or IEN to become registered nurses in Canada. In data by RNAO in 2020, 6,566 new IEN applicants are received by the CNO and 14,888 are currently applying for licenses. Streamlining this pool of IEN for 3 to 6 months and decreasing the processing time to 1 to 3 months and approving at least 2,000 yearly applicants could rapidly strengthen the nursing workforce. Nurse leaders must coordinate with nursing regulatory bodies to form policies and regulation to expedite registration of IENs to practice nursing in Canada. Having a supportive working environment is another strategy to address nurse shortage. According to Tang and Hudson in 2019, allowing staff nurses to have more control over their work, involving in decision-making, increasing salary, and providing awards and feedbacks could help nurse retention and answer nurse shortage. To achieve this, nurse leaders must continually assess the situation of nurses in the workforce to be able to formulate solutions to address the factors that contributes to nursing shortage in the organization. Gene Watson's philosophy and theory of transpersonal caring is a helpful model for tackling the increasing problem of nursing shortage. According to Watson, as cited by Aligood, nurses must realize the impact that people's external and internal circumstances have on their health and sickness. This guides nurses to examine the nurse's environment and situation in order to provide quality care to the patient. Meanwhile, transformational leadership is helpful to nursing shortage since it encourages cooperation because it is collaborative, consultative, and empowering, according to Dhaliwal and Hurst. Nursing leadership demonstrating transformational leadership improves staff retention, strengthens commitment of staff nurses, and enhances staff job satisfaction. According to my research, the process of recruitment and retention are important to achieve appropriate nurse staffing and workload. In the recruitment process, by promoting nursing course during secondary education and providing scholarship and grants to study nursing, this will produce a continuous pool of competent nurses that will fill the shortage. In addition, expediting the processing of registrations of IENs to become nurses in Canada will also help achieve adequate staffing by creating a pool of qualified IENs to practice nursing in Canada. On the other hand, providing supportive working environment maximizes nurses' well-being and sustain their motivation. According to Tinguha in 2017, creating a supporting working environment boosts nurses' morale that results in job satisfaction and increased job retention. Leadership essentially is about the capability to exert changes according to Roberts in 2020. Leaders are created and tested in how they handle and deal with circumstances, especially when staffing constraints are compounded by a large influx of patients. A study by Midauva in 2017 stated nurses are more likely to deliver better healthcare services and boost patient satisfaction when they are content, engaged, and work in a favorable work environment. Also, appropriate staffing lowers mortality and infection rates, shorter hospital stays, and improved patient outcomes, according to Perkins in 2021. Burnout is a possible barrier that will affect an addressing nurse shortage. Burnout is a syndrome characterized by emotional exhaustion that results in depersonalization and decreased personal accomplishment at work, according to Meadow and Willis in 2018. According to Laveau and Tremblay et al. In 2019, burnout is linked to a desire to leave nursing. Thus, this intensifies the problem of nurse shortage and must be also dealt with. With the dynamic state of healthcare and the emerging of new diseases, leaders must guarantee that sustainable long-term policy goals are embedded in well-informed decision-making. Leaders in healthcare organizations should lobby policies and regulations to government and nursing regulatory bodies to sustain the recruitment and retention strategies for nurses. Healthcare officials should attend events that allow them to raise and voice concerns about the nurse shortage at the local, provincial, and federal levels. Nurse workforce impact assessment also should be conducted regularly to better understand the impact of nursing shortage on nurses and nursing workforce. Impact assessment data would be used to improve nursing policy and planning, optimize nurse retention and deployment, increase skill use, assist monitoring of internal nurse flows, and highlight priority actions for further recruitment and retention, according to Buchan et al. In 2022. In addition, good human resource management policies and practice will ensure sustainability by addressing the participation and retention of nurses in labor market. All staff should have proper training and continuous education in addressing future challenges in healthcare system, sustainability of positive workplace environment, and stakeholder engagement. Organizational support for professional development is aimed at improving the nurse staff's ability, according to Lavoie and Tremblay in 2019. As a result, continuing education and training may inspire the nurses and healthcare organizations to establish effective methods for sustaining all resources and behaviors that promote job satisfaction and intent to stay in the profession and address the problem of nurse shortage. Thank you very much for listening and have a wonderful day.